Welcome back, family. This lesson, we will read some definitions of mental illness slash personality disorders, and some you may already be familiar with. What I would like to get you to do, however, as we read these, think about the definitions and apply them to either yourself or someone you may know. The purpose of this exercise is to prove to you that trauma does affect us all, and there may be people you know who may be suffering but have no idea that they are. As a behavioral health technician, it will be your job to spot these signs and tailor your aid to suit that particular individual. Each of them deserves to be treated with respect, and you cannot show a better example of that by listening and hearing what they are saying and not saying. If some of these fit you, then you must be that hero who is not afraid to ask for help and get a better understanding than you may have now. Imagine just how much easier your job will be when that patient can sense that you truly do understand what they're going through. Let's begin with autism spectrum disorder. It is characterized by persistent defects in social interactions and communications in multiple areas of life, as well as restrictive patterns of behavior. It presents in the early stages of life and may cause significant impairment in important areas of life. This disorder strikes very close to home because my youngest son has been diagnosed with autism. My family and I decided that we would not place a limit on his abilities because of this disorder, and we will not allow others to as well. To watch him grow into such an intelligent and special young man leads me to preach this approach to anyone and everyone who has an autistic child. For him, we use my education before expectation approach. I spend as much time as necessary and speak as slowly as I have to, explaining to him what I need him to do while I'm showing him at the same time. Once he gets it and has shown or repeated what I said, a very large smile on my face makes his day, along with a good job comment. Seeing that light come on behind his eyes and the unbridled joy in his face and body language makes my day. At every turn, I will educate him before expecting him to know what he needs to do and how to do it. In other words, we cannot expect for people to know how we're feeling until we educate them. You cannot expect for anyone to know how to do something unless you personally know for a fact that they've been trained to do it. Show first, and then expect something in return. Next is bipolar disorder, which is characterized by shifts in moods as well as changes in activity and energy level. This shift is often between elevated moods and depression. Anxiety disorder is characterized by excessive and persistent fear, worry, anxiety, or other related behavioral disturbances. Panic disorder is characterized by panic attacks that often seem to strike out of the blue and for no reason. Because of this, many who suffer from panic attacks maybe have more because they worry so much about having another one. Attention deficit hyperactivity disorder is characterized by a persistent pattern of hyperactivity, impulsivity, and or inattention that interferes with functioning and presents itself in two or more settings such as home, work, school, and social situations. Separation anxiety disorder is a type of anxiety involving excessive amount of fear or anxiety related to being separated from attachment figures, and symptoms can become so severe that they interfere with normal functioning. Borderline personality disorder is associated with symptoms including emotional instability, unstable and intense interpersonal relationships, unstable self-image, and impulsive behaviors. Histrionic personality disorder is associated with patterns of extreme emotion and attention-seeking behaviors. People suffering from this does not feel comfortable in a setting where they are not the center of attention. Narcissistic personality disorder is associated with a lasting pattern of exaggerated self-image, self-centeredness, and low empathy. People who suffer from this tend to be more interested in themselves than with others. Obsessive compulsive personality disorder is a pervasive pattern of preoccupation with orderliness, perfectionism, inflexibility, and mental and interpersonal control. This disorder, however, should not be confused with just obsessive compulsive disorder or OCD. Thus endeth this lesson. Please don't forget about the quiz. Take a few minutes to think about what you have just learned before moving on to the next lesson. See you soon.